Good morning. My name is Ricardo Alvarez. I am the Director of Breast Cancer Research at Cancer Treatment Center of America, CTCA, in Atlanta, and a Clinical Associate Professor at Augusta University in Georgia. The study 219 is a novel combination of two agents. One of the agents is very well known, eribulin or halaven, with a combination with a molecule that is a PEG hyaluronan. And this is a new concept to treat patients with advanced cancer. This study 219 is a randomized phase 1b, phase 2 clinical trial for patients with a HER2 negative breast cancer that failed the first or second line of prior chemotherapy. The novel of this combination is the PEG PH2O. This is a pegylated liposomal hyaluronan enzyme. So this is a concept that the target is going to be the microenvironment, followed by the treatment with the a microtubular inhibitor that is eribulin. A patient with advanced cancer will be injected 24 hours with this new compound, the PEG PH2O, that this is a pegylated compounds that with hyaluronidase enzyme. And what we try to do in these patients 24 hours later, they will receive the chemotherapy. We know that the cancer is not only cancer cells. Cancer is, we need to learn about the context, the microenvironment. Microenvironment is an area where all of these cancer cells live. The rationale for the combination of these two agents is the first experimental agent will degrade the microenvironment, the glucosaminoglycans, into different proteins or different products, and secondly, the chemotherapy will take care of the cancer cells. The study designed in a phase 1b and phase 2 clinical trial. The phase 1b, the primary endpoint, we will have between 6 to 12 patients to obtain the recommended doses for a phase 2. These are a group of patients with a HER2 negative breast cancer with 1 or 2 previous lines of chemotherapy. We will take all of the data from safety and efficacy. We will have also multiple time points of pharmacokinetics and pharmacodynamics points. And then after we collect this number of patients, we will have the recommended doses for phase 2. We will launch the phase 2 clinical trial. The endpoints for the phase 2 clinical trial is overall response rate, as a secondary endpoint, progression-free survival and overall survival. Other important point of these clinical trials is the biomarker-driven clinical trial. So we will target only the patients with high HA in this case. So we will use this as a novel biomarker to identify a group of population that might be sensitive to this combination.